always go that for me, that's really a kidney microbiome transaction. Because I do think oxalates is a microbiome issue. If you fix a microbiome, then I do see for some people when you get oxalates coming up, then you get all these, you're more likely to get crystallization. The tubules go into hyperdilation to work that, and that's. Hi, everybody. Welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, co-founder of Kidney Coach and the Kidney Disease Solution and our products Cogenesis. And I have the pleasure of being joined again today by one of my favorite guests and favorite people in the world, Dr. Morgan Camp. Hey, Morgan, how are you?
I'm doing great. Thank you. Hi, Fiona, and hi, all your fans out there in the audience. Very happy to be here today. Thank you for having me.
So if you haven't listened to a podcast with Dr. Camp before, he is a functional medicine practitioner. He's been in the functional medicine field for well over 20 years. And you really got in there right from the get-go. Morgan's got a great story that I think we dive into on some other podcasts, but he got into the functional medicine aspect very, very early on. So has been very much in this field. And just one of the things when you get to know Morgan, and one of the things I really appreciate about you, Morgan, is that he really is a continual student, goes out and learns more and more and more and more. He knows so much on bioidentical hormones and longevity and infections and immunotherapy and detoxification and all those sort of things and stress-related illnesses. And then, just keeps expanding his knowledge. So every time I talk to Dr. Camp, he's gone down the rabbit hole of something new and amazing and is just learning every single thing he can about it so he can pass it on to his patients. So he's what I call a true healer, very, very good at getting to the cause, very, very interested at treating people as a person and not a disease, and really is invested in getting people super well and will go out of his way to learn whatever he can to help that happen for people. So we're going to dive into a topic that actually quite a few of my people from my mastery course have been asking me about, and that is the kidney-brain axis, which I've gone and looked and no one really talks about this. And one of the biggest symptoms that people with chronic kidney disease will talk about is the brain fog and the not being able to concentrate, and then actually also mental health disease that we do come along with this. And so I wanted to dive into this as a topic today. So first off, what is the kidney-brain axis? What am I even talking about when I put those two words together?
Good question. Everybody has a little different interpretation of everything, right? So, it's a complex. The way I think of it is our kidneys have many roles, right? I think in this context, one of the things we're talking about is detoxification of toxins and the things we need to get out of there. So from one very simple perspective, it makes common sense why we would have neurological symptoms when our kidneys aren't working, just because the toxins aren't being cleared properly. But it's actually a lot more complex than that, of course. What else? What else does that mean to you, Fiona? Interested.
Well, I think people are beginning to get familiar with the term the gut-brain axis. So people know, okay, this microbiome, we know our gut makes 75% of our serotonin. We know that if the microbiome's out, and I think the other thing that people may or may not know is this leaky gut syndrome, where the gut lining that should look like this becomes like that. And we know that the blood-brain barrier up in the brain tends to mimic the gut barrier. So if you've got a leaky gut syndrome, I often say you've got leaky brain syndrome. And I think
I was going to say, and it's likely that there's some leaky kidney issue going on there also, right? Yeah.
That's exactly what I was about to say. I think when you've got leaky gut and chronic kidney disease, there's a leaky kidney going on. And I think with leaky kidney, we know the microbiome and kidney health are interrelated. I think when you're in chronic kidney disease, there's going to be probably an aspect of leaky gut going on because of what you mentioned with the detox, which is going to have this leaky brain barrier. So I think, it's that interplay that we're sort of looking at everything, right?
The only other thing that comes to mind is oxalates. And that's sort of related to those organic acids we were talking about earlier. They're also related to the fungal and candida overgrowth issue because they are produced by those. They're also are tested in the mosaic organic acid test as well. I think Genova test as well now for the oxalates, I do think. So those are another reason. And I'm not an expert on this, but are oxalates directly kidney toxic? Do you know, Fiona?
Look, I think that it hasn't been proven, but my understanding is, yeah, if you've got oxalates, there seems to be a kidney issue. And I always go that for me, that's really a kidney microbiome transaction. Because I do think oxalates is a microbiome issue. If you fix the microbiome, then the oxalate issues do tend to go away. But I do see for some people, when you get oxalates coming up, then you get all these, you're more likely to get crystallization. What I think happens is that mTOR pathway that I think you and I have spoken about before in mTOR, the tubules go into hyperdilation to work that, and that's a cross reaction to having oxalates, because it's trying to flush the oxalates through, so the tubules hyperdilate and stay that way. So they've just been damaged all the time because they've not got their flexibility in them, and that is a reaction to oxalates, and then it bypasses through the mTOR. I can't remember all the close biochemical pathways, but they're trying to flush oxalates. So if you have oxalates, tubules go into hyperdilation. That's why working on the mTOR pathway in chronic polycystic kidney disease seems to work, because you're giving the flexibility back to the tubules and stopping them dilate all the time, which then the crystals get in there and cause the cysts in polycystic kidney disease pathways. But you might not get the cyst formation in a normal kidney, but you've got this hyperdilated tubule. That's as much as I remember of the biochemistry of that one, Morgan. But
I was talking to Grace Liu, who runs a really cool gut institute. She has some great probiotics that'll help you detoxify oxalates too. We were talking this subject, and she mentioned, I can't remember because I got a little brain fog today. I think she's finding that connection, that can be directly nephrotoxic. For sure, and the big takeaway, one big takeaway around all these acids is alkalinization and hydration. So you want to heal from a chronic disease, any chronic disease, almost any. Well, not there's a few maybe you don't, but almost all of them alkalinize and hydrate. Right? Alkalinize and hydrate. Because again, a lot of these acids are building up in the body from our gut biome dysbiosis, and those acids are they're toxic to the bladder. So a lot of men have interstitial cystitis, and they don't know why. I'm surprised a lot of mainstream gynecologists are now getting that information though. So I'm hearing a lot of my patients talk about oxalates, which I'm really excited about.
Yeah, I am too. Amazing.
Yeah, and the other uric acid. So you get a lot of uric acid issues, which of course are these uremic acids we're talking about. So the uric acid also contributes to heart disease, and gout. So you can get pain episodes from that. So oxalate also causes like diffuse pain of your body. Gout causes more pain localized to certain joints. These are all things I've had, so I can speak clearly on them. But the key with those, if you got any of these and you got a little pain and you're trying to figure out what it is, well, if you learn to alkalinize and hydrate and the pain goes away, then it's some sort of acid in your body that's leaving you, and you're doing the right thing. And in so doing that, you're lowering the progression, more than likely, of your kidney disease. Yeah.
Yeah.
That's the main takeaway the main takeaway from all these is, if you can get all these sort of things out of your system and flushed out, then that disease process that was fueling the kidney disease is now the fires went coming down.
If you want to know more about what we do, head to kidneycoach.com. You can see our products on there, and make sure you hit like and subscribe. That way you will get notified anytime we put up more information. I will definitely get Dr. Camp back on to do a How to Clear Uric Acid Naturally podcast. But if there's anything else you'd like to hear and talk about, or more information on this, chuck in the comments below. I can always reach out to Dr. Camp to get an answer. And then, of course, I'll put his website in below. You can reach him directly through the website if you want to make a consultation and booking with him. Thanks again for listening. Dr. Camp, thank you again for your knowledge, time, and wisdom, and for being who you are. We'll see you all next time. Bye.
Thank you.